Have you ever felt an unusual itch in one specific area that just would not go away? It might seem like nothing, but for seniors, this small symptom could be a warning sign of a stroke. In this video, we will explain why itching in certain spots can be a red flag, especially for older adults. You will learn the key signs to watch for, what they mean, and steps you can take to stay safe. Stick around until the end for valuable tips that could protect your health. For more life-saving health updates, please subscribe and hit the bell icon to stay informed. 1. Persistent itching on the lower legs. Have you ever noticed an annoying itch on one side of your body that just will not stop? For seniors, this could be more than a minor irritation. Persistent itching, especially on the lower legs, can sometimes point to a serious health issue. Let us dive into what this symptom means, why it happens, and what you can do about it. Itching on one side of the body, like the face, arm, or leg, often feels like a nagging sensation. It might be a constant itch or come and go throughout the day. For seniors, this is not always due to dry skin or allergies, which are common culprits. Instead, it could signal something deeper, particularly when the itching is focused on the lower legs. You might notice the skin feels tingly, irritated, or even slightly warm. Sometimes, it is paired with a feeling of heaviness in the leg or mild swelling. This is not the kind of itch that goes away with a quick scratch or some lotion. It lingers, and that is a clue it might be serious. So, what could be causing this? One possible reason is poor circulation, which is common in older adults. Blood flow to the lower legs can slow down due to aging blood vessels or conditions like peripheral artery disease, also called PAD. In PAD, arteries narrow, reducing blood flow to the legs. This can cause itching because the skin and nerves are not getting enough oxygen-rich blood. In some cases, this poor circulation could be a warning sign of a stroke, especially if it is on one side of the body. A stroke happens when blood flow to the brain is blocked or reduced, and symptoms like one-sided itching can appear when the body is under stress from circulation issues. Other signs, like numbness or weakness, might show up too, but itching alone can be an early red flag. If you are experiencing persistent itching on one side, especially the lower legs, do not ignore it. Here is what you can do. First, try gentle movement to boost circulation. A short walk, even 10 minutes a day, can help blood flow better. Avoid sitting or standing in one position for too long. Second, stay hydrated. Drinking enough water keeps your blood from getting too thick, which supports circulation. Aim for 6 to 8 glasses a day unless your doctor says otherwise. Third, check your legs for other signs, like swelling, redness, or warmth, and note if the itching is only on one side. If it persists for more than a few days or gets worse, call your doctor. They might suggest tests, like an ultrasound, to check your blood vessels. It is also a good idea to keep your skin moisturized to rule out dryness as a cause. Use a fragrance-free cream. Do not rely on it alone if the itching continues. Avoid scratching too much, as it can damage the skin and make things worse. If you have diabetes or high blood pressure, be extra cautious, as these conditions can worsen circulation problems. The key is to stay calm but proactive. Persistent itching on the lower legs, especially on one side, is not something to brush off. By paying attention to your body and taking simple steps, you can catch potential issues early. Keep watching for more tips on spotting stroke red flags. If you found this helpful, please subscribe and hit the bell for more health insights. 2. Itching in the neck or the back of the head. This itch often manifests as a nagging, tingly sensation on one side of the neck or at the skull's base. Seniors might describe it as a sharp or warm itch that resists relief. The skin typically appears unchanged, showing no redness or bumps, which can make it perplexing. The sensation may intensify during rest, after stress, or when maintaining one posture for too long. It might fade briefly but returns persistently, occasionally joined by slight heaviness or sensitivity in the area. This focused, one-sided itch raises concern as a potential health signal. Why does this happen? A likely cause is nerve disruption, often tied to aging-related neck issues, such as cervical arthritis or worn spinal discs. These can pinch nerves, altering skin sensations and triggering itching. Another factor might be reduced blood flow, common in older adults. Carotid artery disease, which narrows neck arteries, can limit blood to the head and neck, causing itching or odd sensations. In rare instances, this could warn of a stroke, especially alongside signs like confusion, slurred speech, or arm weakness. A stroke results from interrupted brain blood flow, and early clues like one-sided itching demand attention. Meet Helen, a 69-year-old who enjoys birdwatching. Over several weeks, she noticed a relentless itch on the left side of her neck, near her hairline. She initially blamed her new necklace or dry winter air, yet the itch lingered, worse at night, and she sensed mild stiffness in her shoulder. Alarmed, Helen consulted her physician, who examined her neck's blood flow and detected early carotid artery narrowing. Through diet changes and prescribed treatment, Helen addressed the issue, reducing her stroke risk and calming the itch. If you notice one-sided itching on your neck or the back of your head, respond thoughtfully. Start with light activity, such as a 15-minute stroll or gentle neck tilts, to enhance circulation. Next, ensure proper hydration by sipping 6 to 8 glasses of water daily to aid blood flow. Avoid vigorous scratching, which may harm the skin. Instead, place a cool, moist cloth on the area for comfort. Monitor for additional symptoms, such as dizziness, numbness, or speech issues, and record when the itching occurs. If it persists beyond a few days or grows stronger, reach out to your doctor. They might order a neck artery scan or spinal imaging to investigate. Apply a gentle, unscented moisturizer to check for dry skin, but do not dismiss ongoing itching. Those with high cholesterol, diabetes, or heart conditions should stay especially alert, as these increase circulation risks. Choose loose, soft clothing to prevent irritation, and shift positions regularly to ease neck pressure. Noting symptoms in a small diary can assist your doctor's evaluation. Remain composed but vigilant. One-sided itching in the neck or back of the head warrants attention, particularly for seniors. Early action can safeguard your well-being. Continue watching for stroke warning signs. Please subscribe and tap the bell for more health insights. 3. Itching in the shoulders and arms. Brachioradial Pruritus. Ever felt a stubborn itch in your shoulders or arms that will not quit? For seniors, this could be more than a skin issue. Itching in the shoulders and arms, known as brachioradial pruritus, may signal a serious condition like a stroke. Let us explore what this feels like, why it happens, and steps to stay safe. This itching often targets one shoulder or upper arm, feeling like a burning or prickly sensation. Seniors may notice it worsens at night or after sun exposure, with no visible rash. It might come with tingling or numbness, hinting it is not just skin deep. This one-sided itch can be a red flag, especially if persistent. What causes it? Nerve irritation from neck or spine issues, like arthritis, can trigger this itch by disrupting skin signals. Poor circulation, such as in peripheral artery disease, is another cause. Narrowed arteries reduce blood flow to the arms, causing itching or tingling. In rare cases, this could warn of a stroke, especially with symptoms like weakness or dizziness. A stroke occurs when brain blood flow is blocked, and one-sided itching can be an early clue. Picture Sarah, a 70-year-old. Who loves knitting. For weeks, she had an itch on her left shoulder and arm. She blamed heavy grocery bags, but the itch persisted, especially at night, with slight finger tingling. Her doctor found early peripheral artery disease affecting arm blood flow. With treatment and exercise, Sarah eased the itch and lowered her stroke risk. If you have itching in your shoulders or arms, especially on one side, act calmly. First, try light exercise, like a 10-minute walk, to boost blood flow. Second, drink 6 to 8 glasses of water daily to support circulation. Third, avoid scratching. Use a cool cloth for relief. Fourth, track symptoms like numbness or weakness. If the itch lasts over a few days, call your doctor. They may suggest an MRI for nerve issues or an ultrasound for blood vessels. Moisturize with fragrance-free cream to rule out dry skin, but do not ignore persistent itching. If you have diabetes or high blood pressure, be extra cautious, as these worsen circulation problems. Avoid sun exposure and wear loose clothing to reduce irritation. Stay proactive. One-sided itching in the shoulders or arms is a signal to notice, especially for seniors. Acting early can protect your health. Watch for more stroke red flags. Please subscribe and hit the bell for health tips. 4. Itching in the upper back. Notalgia paresthetica. Notalgia paresthetica is a specific type of itching that targets the upper back, usually on one side, often near the shoulder blades. In seniors, it feels like a deep, nagging itch, sometimes with a burning or tingling sensation. The skin typically looks normal, with no rash or redness, which can make it puzzling. This itch may worsen at night or after prolonged sitting, and scratching offers little relief. Seniors might notice it feels more intense in warm weather or when wearing tight clothing. Occasionally, it comes with mild numbness or a prickly feeling, signaling it may not be just a skin issue. What causes this unusual itching? One common reason is nerve irritation, often from compression in the upper spine due to age-related changes like arthritis or degenerative disc disease. These conditions can disrupt nerve signals to the skin, causing itching. Another possible cause is poor blood circulation, which is more common in older adults. Conditions like peripheral artery disease can reduce blood flow to the upper body, leading to symptoms like itching or tingling. In rare cases, one-sided itching in the upper back could be an early warning of a stroke, especially if paired with other signs like weakness, dizziness, or trouble speaking. A stroke occurs when blood flow to the brain is blocked, and subtle symptoms like itching should not be ignored. If you have itching in your upper back, especially on one side, here is what to do. First, try gentle movement, like a 10-minute walk or shoulder rolls, to improve blood flow. Second, drink 6 to 8 glasses of water daily to support circulation. Third, avoid scratching, as it can irritate the skin further. Instead, apply a cool, damp cloth for relief. Fourth, track symptoms like numbness, weakness, or skin changes, and note when the itching occurs. If it lasts more than a few days or worsens, call your doctor. They may suggest an MRI to check for nerve issues or an ultrasound to assess blood vessels. Keep your skin moisturized with a fragrance-free cream to rule out dryness, but do not rely on it if the itching continues. If you have diabetes, high blood pressure, or heart issues, be extra vigilant, as these can worsen circulation problems. Wear loose, breathable clothing to avoid irritation, and avoid long periods of sitting to reduce pressure on the spine. Stay calm but proactive. One-sided itching in the upper back is a signal to take seriously, especially for seniors. By listening to your body and acting early, you can protect your health. Watch for more stroke warning signs. Please subscribe and hit the bell for more health tips. 5. Itching on the face. especially around the eyes. This type of itching often feels like a constant irritation on one side of the face, particularly near the eyes. Seniors might notice a tingling or burning sensation, sometimes with slight redness or puffiness. It is not the usual itch from allergies or dry skin that spreads across the face. Instead, it stays focused in one area, like around one eye or along one cheek. The itch might come and go, but it keeps returning, often feeling worse at certain times of the day, like in the evening. In some cases, it may be paired with mild numbness or a feeling that the skin is overly sensitive. This kind of specific, one-sided itching is what makes it a potential red flag. What could be behind this symptom? One possible cause is related to blood flow issues, which can affect the nerves and skin on the face. For example, a condition called carotid artery disease can reduce blood flow through the arteries in the neck that supply the face and brain. When blood flow is limited, the skin and nerves may not get enough oxygen, leading to sensations like itching. In rare cases, this can be an early sign of a stroke, especially if the itching is on one side of the face. A stroke occurs when blood flow to the brain is disrupted, and unusual sensations like itching can appear when the body is signaling a problem. Other symptoms, like drooping on one side of the face or trouble speaking, might follow. But itching alone can be an early clue. If you are dealing with persistent itching on one side of your face, especially around the eyes, here is what you can do. First, keep your face clean and moisturized with a gentle, fragrance-free cream to rule out dry skin. Apply it lightly to avoid irritation. Second, stay hydrated by drinking 6 to 8 glasses of water daily, as this supports healthy blood flow. Third, try to reduce stress, which can worsen circulation issues. Simple activities like deep breathing or a short walk can help. Fourth, pay attention to other symptoms, like numbness, weakness, or vision changes on the same side. If the itching lasts more than a few days or gets worse, contact your doctor right away. They may recommend tests, like an ultrasound of your neck arteries, to check for blockages. Avoid scratching the itchy area too much, as it can irritate the skin further or cause small injuries. If you have high cholesterol, high blood pressure, or a history of heart issues, be extra vigilant, as these can increase the risk of artery problems. Keep a notebook to track when the itching happens and any other symptoms, as this can help your doctor diagnose the issue. Stay calm but take action. Itching on one side of the face, especially around the eyes, is not something to ignore, particularly for seniors. By listening to your body and acting early, you can protect your health. Keep watching for more stroke warning signs. Please subscribe and hit the bell for future health tips. This video showed that itching in specific areas can be a stroke warning for seniors. Small signs carry deep meaning. Do not ignore them. Trust your body, stay aware, and act early. Knowledge is your strength. Take one step today. Check a symptom, call a doctor, or share this with someone you care about. You are stronger than you know, and your health is worth it. Drop one insight in the comments below. Subscribe to stay informed with more life-saving tips. Keep standing tall